Well, good afternoon, everyone, and thank you for joining in. I'm Michelle Disa, and it gives me immense pleasure to welcome you all to the first series of the webinar, Development Sector's Response to COVID-19, Gaps, Learnings, and Way Forward, hosted by Third Sector Partners in collaboration with our partner organizations Go Barefoot, a membership-based interactive web portal dedicated to the social sector, and Catalyst, a social initiative which prepares young women pursuing professional education for leadership roles, thereby creating a wider talent pool for India Inc. and helping bridge the gender divide. In the current situation, the development sector too is grappling with issues related to people, processes, and funds. Although we are facing unique challenges, we have an opportunity to become resilient, innovative, and emerge as leaders in our own spheres. Our first webinar has CEOs and country heads of renowned organizations in the social sector, sharing a leader's view on how they were able to navigate the crisis and adapt to the new normal. Over the next 40 minutes, we're going to be doing a panel discussion with our esteemed panelists, who I'll introduce shortly. I will be moderating the session, and through which we hope to get responses to various questions. We have reserved the last 15 minutes to address questions from the audience. Let me introduce the panel members once again. We have Amitabh Bihar, CEO of Oxfam, Jayanti Shukla, CEO United Way Mumbai, Sumitra Mishra, Executive Director, Mobile Precious, and Neeraj Jain, Country Director, India for PATH. Thank you, panel members, for accepting our invitation. Well, the COVID crisis was something none of us anticipated, and it brought the world to a standstill. And there is no easy route out of this crisis. Leaders heading organizations are required to be flexible, adaptive, and be willing to make difficult decisions, and at the same time, steer the way forward for the organization. And with that, Neeraj, I would like to pose my first question to you. At PATH, in the wake of the current crisis, what are the risk mitigation strategies that you have initiated? And what are some of the strategic decisions that you took to meet or probably realign your organization's long-term objectives?
Michelle, firstly, I'd like to thank I know you guys for many years and we've been doing that work, so great to have, and of course, my fellow panelists. I think I'm just going to step back a little bit here, Michelle. When we talk about, how are we going to navigate, what are our long-term priorities, etc. I think the first thing I want to just put up front is that we actually don't still know what we're dealing with. We are still in the middle of trying to figure out where we are. I was saying to some.
Okay, I think Neeraj has got dropped off. Well, while we get Neeraj back, Jayanti, would you like to share your views on the same question?
So when COVID struck and we realized that this was going to be there for quite some time now, we knew that it's not going to be work as usual for quite a while, and it's going to be an evolving situation probably every week or every month. So, but having said that, we couldn't just be sitting and not doing something. So we divided our strategy into three parts. One is what do we need to do in the office with the team? What do we need to do from an organization level? And what do we need to do for our projects? So for the team, I think everyone, all my other speakers will understand, how do you get your team aligned, because you're not meeting them face to face anymore. How are you going to make sure that your program, your interaction still remains on track? So we quickly put everything that we had up on cloud, so that even from home, we could access our, back-end work and all our storage, whatever we had in office, we could access that. And we had to do that really fast. Can we also better about simplifying the process? Like approvals had to be taken earlier. I mean, you could probably just walk up to the finance department and get, money out from them, or walk into my room and get an MOU signed. You couldn't do that anymore. So how do you simplify that? Put everything online. Put system checks, processes online. And also, obviously, the need to stay connected. So all the facilities that we are all familiar with, even what we are doing right now, the video conferencing, the Slack, Zoom, the Cisco WebEx, everything was put in place. I mean, of course, it kept evolving. The main thing that we did was get into a contingency planning mode. And we realized that what we need to do is firstly look at it in two ways. One is the likely scenario, what could happen in India, and assuming that India is going to get normal, say, by March of next year. The other thing would be a worst case scenario, that things just don't get okay. And, we have to wait for 2 years to think what things to get okay. And having these two images in front of us, we bucketed all our grants sector-wise. So by then we knew by the trends in the sector, which corporate sector was going to do badly, very badly, may get permanently affected. And then see, where is your funding coming from? Is it coming from the finance sector? Is it coming from an insurance sector? Is it an FMCG? Is it petrochemical? What is it? I mean, and how are they going to get affected, and how would that in turn affect the grant that is coming to us? And then basis that and understanding what would be the impact of COVID on that corporate of us, look at what would be the donors' assurance of continuity with the grant. This exercise is something that we do every month. I mean, every month we look at our entire database of corporate partners and see, again, from the likely scenario and the worst case scenario, whether there's been any shift. So I know this is evolving, but that gives us something to actually work towards with a more structured way of doing things. And then coming down to the program level, there are some programs which just could not go on because that it's not going to get grants at all because it's not relevant. I mean, you assume that you'll not get grants, but that doesn't mean you can close the program, right? You're invested in it. So how is it that you can pivot the program maybe to have in it an element of COVID or the effect of COVID, see that you can still reach out and get funding? Because last year was assumably good for everybody, obviously in comparison to what we're going through right now. But this year is not going to be the same. Flagship programs are not going to be as good. So the ability to pivot the programs and pivot the way we look at our grants, I think is what is going to keep us all relevant also vis-a-vis our work.
Sure. Thank you, Jayanti. Some really interesting points that you have put out there. I have Neeraj who's joined us back. Well, Neeraj,
sorry about that. I think
continue.
Somebody told me Zoom is a Chinese program and they're going to boycott it. So I think they've decided to act funny already. But just coming back, I think what I was trying to say was that we don't know how long this is going to be. So in terms of our own strategic shift, the big shift that we made is to kind of start living in this world of not knowing how things are going to pan out. Thankfully, we're a public health organization and COVID is a public health issue. So from that perspective, we say it's a dream come true, but it's a very bad dream that's come true. We talked about it for many decades and now it's actually happened. But what we are seeing is very interesting. On one side, we have to worry about safety and, making sure that our teams are safe, etc. The other, we are the frontline workers of public health. We need to be out there. We need to be supporting right in the front. Actually, what many of our teams have been doing. I think, just to sort of add to what Jayanti's already said, I think where we are going is probably, and we've done a lot of strategic thinking around this, that it's more moving towards accelerated development. Patience is going down with donors. So we are seeing that we may probably have to adjust around that. The government is also, from a demand side, work with people on the ground, etc. Now it's moving to the supply side. How do we get in there? How do we make sure that the supply side is working and make sure that things work? The interesting shift we're also seeing is this huge attention to public health. From our perspective, being an organization working in the health sector, we're seeing a massive amount of attention being given to the public health space, which means we have a great opportunity to really try and change the health systems of the country. So, we're seeing that as a huge, massive opportunity and thinking about how we could deal with it. In terms of donors, it's been an interesting bag because we've got donors who actually read their grants and said, go ahead and use it for COVID relief. But as the programs are coming back on track, we can't get out of COVID, and we've also got to hit the ground with the other programs. We're having challenges of having to recruit people actually to be able to start delivering on some of these programs and making sure that we're able to balance the two. The donors are also, the corporate donors are looking at top lines and back grants, and that's been a challenge. Of course, fortunately for us, we are not very much exposed to it, but I'm sure a lot of other NGOs are, and corporate donors have started canceling grants. So we're kind of figuring out how those programs need to evolve or shut down. That also might be happening in some cases, but we're really reviewing that very sort of continuously. And also one big area that we have been working on is really positioning PATH for new funding, because again, there is a lot of new funding that's coming into public health. It's an opportunity for PATH to actually go out and do some good work. So that's been another area. So that's been the interesting kind of shift that we've seen within PATH.
Okay. Well, thank you, Neeraj. We will be talking more on a few of the points that you spoke about, safety of team members, funding, also a little bit more on public health on the whole. Moving further, Amitabh, my next question is to you. Oxfam is known to have a long and well-recognized record of humanitarian response interventions, and hence, was your organization better prepared? And how did you augment your response strategy to meet the current need?
Sure. So thank you, Michelle, and thank you, Third Sector, for inviting me. I must say that I'm very happy to be part of this conversation, in particular because we are now doing conversations which are sector-wide, and we have not done enough of those conversations earlier. So it's good, and I'm seeing a lot of interest in trying to understand how the sector is responding to this crisis. But let me try and respond to your specific question. As it's already been said, indicated, we are all aware, but I just still want to say what we are facing is absolutely unprecedented. And let me say, particularly because you talked of our humanitarian work, it appears as if it is a humanitarian crisis, but it is of a very different nature and dimension. Just to put it simply, look at the last 5 years of our responses. It was whether it a cyclone in Orissa, or floods in Kerala, or earthquakes and so on. So this is something which is not location specific, which really changes the whole conversation. Second, while you're responding to it, in most of these humanitarian crises, very often the major crisis is over. It is then the fallout of the crisis. And therefore, the challenges that you face on an ongoing basis are not there. But the third, I think what I really want to say, and for this group, I think it's critical, that I would still say that at least 85% of the crisis that we have in this country is policy induced. And it's only 15% which is because of the virus. Yes, as Jayanti was saying, maybe in 6 months' time, the health piece is going to become bigger. But what we have seen, the suffering, the trauma, the hunger, starvation that we've seen is primarily a policy-induced crisis. And therefore, it is not necessarily the DRR piece or a humanitarian piece which prepared us. Having said that, let me just say, quickly, how did we respond and why I think we were reasonably well prepared. So it certainly was our humanitarian experience in which we, just the basic framework, which seems fairly simple and logical, but to apply that quickly, that you will have a immediate emergency phase, and we've been working on that. But let me also say that, I feel sad that I told my colleagues that let's prepare for 2 weeks, 3 weeks of emergency, and then we'll start moving to the rehabilitation phase. And every morning I still get 5 calls saying that there's serious emergency even now. So our ability to try and at least understand what are the emergency requirements, So we were able to quickly move on to that. The second is then to start planning rehabilitation. In some places, we have started doing that, say in terms of livelihood, started direct cash transfers to ensure that livelihoods are revived. And then the third is what we call as building sustainable futures. So I think this framework also helped us. Additionally, what I think was really critical for us, and let me just flag two or three things. One was the composite nature of Oxfam, that it does work on a whole range of issues. So let me say that when we realized that it is policy induced and the dimensions are so multiple, we were able to very quickly bring in our media and comms unit to play. So whether what we did with the NDTV, but that was just one piece which was more prominent, but we are reaching out to both national media with very clear agendas. So that really worked very well for us. I would even say that our work, ongoing work and campaign work on right to education, right to health, gave us a very, very strong footing in terms of responding to it. And just finally, I would say that what we were also able to do is leverage, and I think that's moving ahead a critical conversation for all of us, leverage the work that we do in our other thematics. For instance, we were the early ones to start talking about gender-based violence, and which has actually seen an increase during the lockdown period, and taking it to the policymakers and working with that. And it gave us the grounding, the relationships with the National Disaster Management Authority, the state disaster management authorities. But I think it's the abundance of the portfolios that we have, which really helped us move quickly. Thank you.
Thank you, Amitabh. That's a really very interesting perspective, and thanks for sharing how you all were able to move ahead in these times. A quick reminder here to the participants, you could start sending in your questions. We will then address these questions during the last 10 minutes of the session. Moving quickly to Sumitra, my next question is for you. Since Mobile Creches works on early childhood care and development of marginalized children, and I believe that there would be a huge population from these who are migrant workers who have now moved back to their hometowns. How has this impacted your ongoing programs?
Well, thank you, Michelle, for inviting me to be a part of this very useful discussion at this point of the pandemic arc. You can imagine that this pandemic has actually hit the DNA of Mobile Creches. For more than 50 years, we've been working with the children of migrant workers, especially women workers in the unorganized sector like construction work, bricklayers, factory workers, domestic workers, and other such casual daily wage workers through our creche and daycare program. We are all witnessing how badly this population has been affected during this time, especially women and children being affected and yet remaining invisible during this pandemic. And much of it is due to the policy reference that Amitabh made earlier. So quite literally, this pandemic has not only hit the whole world, it's in a way imploded within Mobile Creches also. So there are lots of ways in which obviously the work of the organization and the communities that we work with are affected. But just for this discussion, I want to quickly list down the three immediate impact that we have already experienced and our immediate response to that also. The first was that as an organization, our focus has always been central to the young children under 6 years of age primarily. And their whole holistic integrated needs during that critical period. But as soon as the lockdown was announced, we realized that our response within these communities cannot be limited to just the children, because families overall were suffering due to the immediate loss of income, food, and even shelter requirements. So our first response has been to provide support through to overall families, as well as to sometimes even communities where children were not necessarily interacting with our programs, but community is within them, households were hungry or had no access to PDS ration, and so we've had to immediately reorganize our work to reach out to overall families. The second thing, I think we must understand that our core operation is to provide quality childcare as an entitlement of women workers, particularly in the unorganized sector. Uh, so our work is very closely linked to the state of economy and labor force participation, particularly women's work participation. With the reverse migration exodus that we've all seen within our own communities where we were present before the lockdown, we've already seen more than 50% of migrant workers leaving the construction sites, and around 25 to 30% of the urban slums being vacated. People have moved out. We know that economy is going to take a long time. It's going to be a slow burn. And even within that, women will find it harder to come back to work. CMIE report is already suggesting that women will be joining the workforce much later than men. So clearly the demand for childcare is going to go down. And that's an immediate impact on our work. And as Neeraj also mentioned, therefore our focus is already beginning on the supply side. Even though there is not going to be as much demand for creches at work sites, that doesn't mean that the vulnerabilities of children is going to go away. In fact, it's going to get far worse and get further marginalized. Therefore, our whole plan would be to work on the supply side, reach children where they are, to provide them this support, so that that also acts as an enabler for more and more women to join work faster. The third and the most unique way in which COVID has impacted us is to do with this whole idea of physical distancing and social distancing. How on earth are you going to hold a baby, feed a baby, love a child, play games, talk, coo to a young baby and toddler, maintaining physical and social distance? It's unimaginable. It's turned the whole principles of early childhood development in its head. So that has also led to an impact of what do we do in order to continue providing this kind of a nurturing care to children through remote programs, through phone-based programs. And that needed a lot of quick thinking, planning, retraining our own teams in order to now provide early childhood development support to young children and their families through a physically and socially distant method. I'll stop here.
Thank you, Sumitra. Some very interesting points that you touched upon, specifically to early childhood development. And I'll quickly move ahead with our next question. And Jayanti, this question is for you. I know it's a transformative moment right now for philanthropy. And Jayanti, we have seen that many corporates and HNIs have donated to the PM Cares Fund. What, according to you, is the way forward to raise funds? And considering that the money coming in right now is more focused on relief work, how do organizations raise funds for their programs that they're currently working on?
So, United Way Mumbai, we handle a lot of grants. We are CSR partners for a lot of major corporates, and we also have our own programs. The model where we work is that we get a lot of stakeholders to come together, because we realize that if anything has to be solved in a community, it requires more than one organization or one individual to come forward. And obviously all this needs a lot of funds. And since I just said that our major programs are CSR funded, not by HNIs or anyone else. So this again became an issue that is absolutely, critical for us. And when the PM Cares Fund was instituted, the government became our biggest competitor because firstly, fully tax deductible, and it qualified for the 2% CSR. So that took away, immediately it was like, we don't know how much of our immediate corporate funding is going to get hit. And yes, that was actually a very real threat. because the temptation of giving it to the PM CARES fund is really high because it's 100% tax exemption that you're getting. So, for us, it was like, okay, now to what extent do we have to relook at the way we are reaching out to our corporates? The other thing we realized was, and we all need to understand, is this pandemic is basically straddling 2 financial years. Q4 of 1920, where the funding was already committed and you knew for a fact that was fine. So the program at least till then was okay. And Q1 was when the entire pandemic took real strong control. And that is when, the impacts started being felt. Normally the corporate would, work on closing off their books of accounts and getting into, understanding how much CSR funding is there in Q1. And Q2 is generally when you actually start understanding how much funding is coming your way. But all corporates put this on fast track in Q1 itself. So in Q1 itself, everyone decided money has to go out to programs, whether it is PM CARES fund or whatever. The decisions started getting taken in Q1. So it was an opportunity also for us because immediately there was scope to reach out to so much more CSR funding with the understanding that PM CARES fund is always going to be our largest competitor. So for us, recognizing the fact that this is actually a great opportunity worked well because a lot of our corporate donors preferred to give it to a program rather than give it to the PM. It's not that everyone did that, but at least a majority of them preferred to give it to a program because they wanted to actually see where the money is going and they wanted, a report and to be able to share it with their employees, etc. So we did get a lot of funding, which was towards the immediate relief. The fear always is that with everything coming towards immediate relief, what happens after that? We are now actually at the cusp of moving towards the recovery phase because the relief phase is now reached a point where, things are more or less in control, more or less. But for the recovery phase, is there money or not? I believe there is. Because the CSR funding for this year is basically, what has come because of the profits of last year. So this year I'm not too worried about the funding situation. It's the next year that we need to get worried about. So if we are able to plan our funding channels well this year, recognizing the fact that the money which has come for immediate relief is over, but there is still money and there are still corporates who are willing to now come forward and support programs for the recovery period. Like you mentioned, Sumitra, about the migrants issue. It's not going to go away immediately. I mean, some of the migrants are going to come back. Today's paper said that almost on a daily basis, there are migrants coming back with their families because obviously they want to come back and work. You have to now start looking at their rehabilitation, skill development, employment for them. So the recovery phase also gives us in the non-profit sector a huge opportunity to build completely different programs. And as you said, with social distancing in view, how do you now re-look at your program so as to make it relevant to the new normal and also look forward to getting funding? I'm quite confident that this year's CSR funding, with a little bit of effort, with a little bit of planning, with a little bit of repositioning of our program, should be fine. Our challenge is going to be next year and the year after that. And I think that's probably looking a little into the future. And right now it may be a little preemptive. But as of now, I think if we look at this year, bide time, keep our programs going, the year after that is something we probably need to worry a little later.
Thank you, Jayanti. Some interesting views coming in there. Amitabh, I would like to pose the same question to you as well.
So thank you, Michelle. So, let me first start by saying that probably Jayanti was more fortunate. A lot of serious promises from CSR actually moved to the PM CARES. So it was quite devastating in many ways, and really significant ones did move to the PM CARES. And then there are obviously several concerns about the accountability, transparency of the PM CARES, but that's the conversation for some other time. But it did hit certainly in terms of the resources which could have been available to the sector. But let me also say that what we have seen is an absolutely unprecedented coming forward of, I would even say, philanthropists, corporates, CSRs, and individual retail givers who have really seen the plight of what's happening in the country and have come forward. So there is clearly a significant increase in giving at the moment. However, this has to be seen as in completely agreeing with Jayanti that ultimately what we are looking at is look at the numbers, what we are reading. Every day you get a different number, but it's fairly clear that there's going to be a 5 to 6% contraction of the Indian economy. You're, on the other hand, ILO is saying almost 300 to 400 million people. That's mind-boggling. Number of people will go below the poverty line. So in terms of people's ability to give, in terms of corporates to even earn profits, is going to go down dramatically. And therefore, the money in the sector is going to come down. As in, yes, as Neeraj was saying, absolutely right, that maybe specific pieces might get more resources, and rightly so, legitimately so in the current context. But overall, it's going to be a hugely difficult financial outlook for all of us. And we need to prepare, and there are going to be several ways of preparing ourselves for it. And for instance, the Oxfam, we earn significant amount from trading. Globally, you know that we have shops around the world, but all our shops are closed. And that's a significant loss every month that we are incurring. So in this, I think what we have been doing, one of the things I would want to specifically mention is that as Oxfam, we did take the lead and reached out to 3 major philanthropists / companies. So Rishad Premji, Rohini Nilekani, and Vidya Shah. They came together. We facilitated that conversation in bringing it together. They've actually worked on a pledge of how donors should now give the do the giving over the next few months, at least in the COVID context. And a couple of things which I think are very, very critical. One is flexible funding, where we need to be far more responsive to what's coming from the ground. Second, willingness to support core funds. That's also been clearly an ask that I'm hearing from around. The third, again, I think what Jayanti has already said, this appreciation that the immediate relief is very critical and hugely demanding, but there is a very tough battle ahead of us. And it's going to be in all the pieces. So how do you start planning for that? So, those are the range of pieces that we would need to work on. But I do think this is the moment where we will need some kind of a new global compact, a compact within the country as well, in terms of how do we generate more resources. And in all this, let me just end by saying one piece that I don't see enough is investments and in fact, that's a critical question for this group, all of us here, that as civil society, will we be limited to service delivery? Or at least a small percentage should go into pieces of accountability, because that's where you can then leverage the larger government resources to make it accountable, so that you get the bang for the buck. You ensure accountability of that much larger resource pot, so that you're getting the outcomes that we are looking for. Thank you.
Thank you, Amitabh. Some very interesting takeaways for the audience here, particularly on the subject of how we're going to raise funds in the future. I think Jayanti has a point to make here. Yes, Jayanti?
So I just wanted to add, I think there's also an opportunity now to think a little out of the box, because there are different NGOs with different strengths, but NGOs coming together and sharing grants or sharing a program and doing it together is also something that we probably need to think about, because there's so much strength within the sector, and we've been able to form so many new relationships because of this challenge, and each one realizing that the other one has some strength. So the need to completely rejig the way we even look at our own sector, probably this is the right time to do it. And if each one of us has a strength, which may not be adequate to understand the magnitude of the entire program. But if we came together on a common program and work together, I think that also probably takes the money a longer distance.
Thanks, Jayanti. Moving ahead, Neeraj, my next question is for you. While public health organizations are now dealing with COVID-19 and are we creating other health challenges that we are not paying attention to?
Absolutely, Michelle. This is you've hit the nail on the head, because frankly, the biggest collateral damage that we are causing, and we've starting March, and not just in India, across the world, but I'll speak more to India, has been the complete halt of other programs, and some very, I would say, some very dangerous ground we are standing on. Because if you talk about, for example, vector-borne diseases, talk about dengue, for example, and we're going into monsoons in the next, in Delhi, at least next week, which is high mosquito season, dengue, malaria, chikungunya. We just haven't managed to do the things we've been doing every year, even basic stuff to keep us safe. Just giving an example, Singapore this year has seen doubling of dengue rates only because of COVID, because their health system's been sort of responding to COVID, and people have missed out on the dengue piece. In TB, there's another interesting one. We've been working on an elimination program with government of India for the last few years, and the elimination target for India is 2025. Notifications of TB have gone down by 50%. In the last few months. That means about 300,000 new notifications of TB patients have just not come in. So you've suddenly sort of halted that program. And even today, while we are starting slowly cranking the machinery, but if you look at the number of COVID patients, that's still shooting up. So we've got that graph going upwards, and we're sitting here and saying we can't not do that work. So how do we balance that? Finally, I want to talk a little bit about, everybody here, I think, knows that we're waiting for a COVID vaccine. I'm presuming everybody has been reading about the 200 odd vaccine candidates. But can you believe it? COVID has caused all our other immunization programs to come to a stop. Entire immunization program of India has not been working. I'm sure a lot of my colleagues here or my partners would be working or would have known about it. So imagine all these children are not getting immunized. The maternal newborn child health program is not working. So the health systems just come to a halt. And even today, I can tell you a lot of people don't want to go to the health system for fear of COVID. So we've also created this fear psychosis, which is don't go to a health center, don't connect with the health system because of the fear of COVID. So, it's going to be a challenge. And I think going back to what Amitabh was talking about, this whole policy piece, I think we've created, with all the policies, we've also created a lot of fear. Some which was probably true, some which is not true, as we know, as WHO also has been sort of shifting gears and telling us new things every day. I think we've gone a little out of hand, and it's going to be critical for us to make that come back quickly and get our health system working while we deal with COVID. We have to deal with COVID, but we need to get our health system working. Thank you.
Thank you, Neeraj. Some very interesting inputs that you have put out there. Moving ahead, Sumitra, my next question is for you. We're hearing that most organizations have had to revisit their annual plans. And what strategies have you had to change in the wake of this current situation?
Well, Michelle, as you can see, what Jayanti mentioned and Amitabh also added to it, clearly the world around us is going through a big disruption in terms of funding and movement of funds. So, and also the whole migration piece has exploded. So we've had to go very quickly back into our drawing boards to review our plans and to be more pragmatic in our approach. I'm so happy to hear what Neeraj mentioned about this whole a counter pandemic that we are creating in our response to the COVID pandemic. The entire primary health system has collapsed. Children's immunization, pregnant and lactating mothers, antenatal postnatal checkup, health services, institutional delivery, everything has been halted. And equally urgently, nutrition programs have been halted. We already were carrying a burden of high malnutrition in this country. And this is only going to make things worse. It's not going to go away. It's going to get worse. In view of all of these things, what were some of the guiding principles that we have been guided by over the last couple of months in reviewing our plans and budgets into the future? And of course, as Jayanti very correctly mentioned, this is going to be a long haul. This is not just for the planning for the next 9 months, but we're really looking at a 2 to 3 years planning here. The first thing that has been a guiding force is to remain mission focused. The need for vulnerable children to continue to have urgent requirements for health, nutrition, learning, care and protection is not going to go away. Parents will need that support in their responsive caregiving parenting. So how do we continue to remain mission focused but change our pathways towards reaching these goals, the outcomes, the planned outcomes that we have, has been something that we've been deliberating and revising our plans through that lens. Of course, the second most critical piece during our revision of plans has been on our own people. In MC, as in every other organization, your people are your first and biggest strength. So keeping people safe, healthy, emotionally and mentally healthy also has been a big focus of our revised plans. Moving to work from home, all systems and processes was fairly easy because Mobile Crush is a process oriented organization. We've had, sophisticated ERP systems in place. So it wasn't a big change, but the cultural adaptation to it was amazing, how people adopted this new technology. So building that resilience of people is going to help build the resilience of the organization into the next 2 to 3 years. Of course, some of the harder decisions that we took immediately was to stop all new recruitments, to halt all increments and promotions this year. And the entire organization rallied together to say, this is going to be a difficult year. Children need us the most. We have to be there on the ground somehow to keep the work going. This is something that we'll take on our chin and we'll walk out of this period and have a whole story to talk about. The other thing, of course, has been to remain pragmatic. Jayanti mentions, Neeraj said, Amitabh said, be realistic about what we can do and what we can achieve within the funding and the human resource that we currently have. The first thing, of course, has been to cut some costs, especially the overhead costs, pause all kinds of planned expansion and innovations that we had in mind for this year. Look very carefully at the secured funding that we have, talk to donors, and exactly what Amitabh said, some of the promised commitments from CSR funding is collapsing around Mobile Crush, and Mobile Crush is small compared to Oxfam, and we are facing that as well. But also look very carefully at our general reserves to say that if we do need to continue to do the core programs that we have to do and sustain and take care of this very highly committed, trained workforce that we have, what kind of unrestricted funding that we need to use and at what timeline. So very clear planning, financial planning is going on within the organization. And finally, I think what we are all facing is, and what Neeraj said in one of his opening remarks, is to just remember that this is unprecedented, this is unknown, be prepared to face the unknown, remain open to change and adapt plans with a shorter turnaround time, so that what we are doing remains relevant for the communities on the ground. And for that, one important thing is to remain data driven and evidence driven. So a lot of focus on gathering data from the ground that will help us to take some of these decisions.
Thank you, Sumitra, for those interesting points that you've put out there. You did mention a few points even about work culture and how we're able to maintain work environment and organization culture. The COVID-19 crisis has sparked a revolution in terms of working from home, and it is putting organizations' work culture to test. So Jayanti, my next question is ideally for you. In the wake of the current crisis and the evolving landscape, how can one maintain the work environment and organization culture?
Actually, I really like the comments that Sumitra made, because they were very practical and very much, what any organization would be going through right now. So I really thank you for that, Sumitra. Coming to what we did at United Way Mumbai it was sometime, I think, by end of February that we realized that we needed to probably start moving into work from home. At that time, even the lockdown hadn't been announced. And, the realization that this could probably be there for a while. By then it was, I think, quite evident. There are immense advantages of working from an office. And I personally am of the nature where I would prefer to go to office, because I think when you meet a person and you interact with a person, there are a lot more, non-verbal cues that you get when you're meeting a person that you would not get on a Zoom call or a phone call. Because a Zoom call is only one person talking, everybody else listening. So the advantage of having a meeting and you're seeing the non-verbal cues and having that interaction is never going to be there. But now that you know that this is the new normal and you have to start working from home and continue for quite some time. Now, I know like Mumbai, the city has opened out, and with all the restrictions of 10% attendance in office and all that, people have started going back to office. However, we have not. But we know for a fact that this working from home, even with the staggered attendance or whatever, is going to continue at least probably for 6 to 8 to maybe even 10 to or more months than that. But when you're working from home, when you know that you have to now depend a lot more on not seeing people all together, the trust that you have to place on the team becomes so much higher. I think at this point, it's very important that you should have very well laid out plans. What are going to be the individual responsibilities, what are going to be the team responsibilities, and how they're going to, and the clarity to be given to the team that how is this going to impact the entire organization's work. We have regular reviews, and I'm sure everybody on the panel does the same thing. Catch-ups are there, either individual catch-ups are there or with the team, and then once every fortnight, the entire organization gets onto a Zoom call, which is actually quite a bit of fun, because I don't want it to be very heavy and like a reporting thing, but it's more light-hearted, where people share what they have experienced in all these days. And we have a very large team which is also working outside, on programs and all, and they share the little quirky experiences that they've had when they went to a particular hospital. What did they see? That sort of makes it easier for the rest of the team also to understand the magnitude of the work a particular segment of the team is doing, which otherwise you would have probably had when you were in office and everyone was talking together. So the main thing is the efforts to be made to reinforce the fact that you're still bound by a common objective, that your organization's mission, the reason for which we are in this work stays paramount in everyone's mind. Now, United Way Mumbai was awarded a Great Place to Work certification at the beginning of this year. And that was because of our work environment and organization culture. So it was incumbent on me as the person who is leading the team that this certification, there has to be a really strong reason for having this certification in place and making sure that the work environment and the organization culture continues to be what it used to be earlier. So we celebrate small and big wins when we have our organization Zoom calls. We share a lot of updates. We recognize good work. There is, people are encouraged to come forward and share. But there's always this underlying fear, and I think is there for everyone. Again, is the impact of emotional and mental. What's happening to your mental health. Because while we make all efforts to see to it that the team stays empowered, stay happy, the messaging is always positive, but there's a lot of stuff that comes from the outer world, and that can play on your mind, and you're not working together where you can share information, you're working inside of yourself. So we have tried to also to the team that your mental health your emotional health is really important for us. If you ever need to reach out, like I say, I'm there as a senior most of the team. I'm there. Do reach out to me. If you think you need to talk to somebody else, probably even facilitate that. So that messaging also is continuously given. That it's not going to be all about. I have some team members sending out mails at 10, 30, 11 at night. I know the program demands it because there probably be some activity happening the next morning, and that worries me because the team member is working under pressure, and you're also doing it because you're taking it as a commitment. So I'm not going to let the rest of the team down. But that is putting pressure on the individual. So trying to send across that message that yes, there has to be a time when you're going to stop working. You have to stop working and then you're going to take that time off from work. So that you maybe the weekend you should not be doing anything at all. It's difficult, but it's something that we try and make sure that, you know, the ability to manage the work pressure, and the pressure has increased. We're forever on phone calls. We're forever talking either on conversations, or we discussed before this, the webinar started, that it seems that the work has increased. So how do you try and manage this extra workload and yet be able to, you know, keep it like work is normal? One thing I know for a fact is that I would not be happy to enforce any office attendance unless the employee is very confident and very comfortable about wanting to go back into the work environment. If that is the case, then I have to see to it that the work from home situation is as empowering as is possible, because that is now going to be the new normal.
Thank you, Jayanti. I know some employees are fortunate that they can work remotely. And we do have some employees who have no choice, but they have to be out there on the field for relief work, putting their life to risk as well as that of their family members. And Amitabh, really quick, I would like to hear a few thoughts from you on this. I do see that we do have a couple of questions, and then we'll take one or two audience questions and we'll progress ahead. Yes, Amitabh.
Sure. So I'm mindful of the time. So just very quickly, I think what Sumitra and Jayanti have said gives us the big organizational picture. But I assume your question is also when we are working in the field. So we did have a lot of our colleagues going to the field from very early on. It was difficult, but let me say that we had an advantage because we were quite engaged, heavily engaged in actually capacity building of even frontline health workers. So we were fairly clear in terms of the do's and don'ts. And we've also been providing support in the form of PPE kits to hospitals, to police personnel, and again, frontline health workers. So we had the equipment for our colleagues. So both in terms of training and understanding, and also equipment, we were able to provide that. But let me just say, and just to give you one small example, we started immediately as soon as we saw this huge migration happening. We started a project called Pathik, where our trucks with food were actually on the national highways. And people who were going there would come back pretty much broken in the evening, not because of the heat, but because of the stories that they were hearing. To really get those heart-wrenching stories, it was extremely difficult. And I think we have since then very systematically ensured that we are doing adequate listening and also celebrating the good work that we are doing. But let me say, and the common thread that I've heard, given that the crisis has been so enormous, I think I see a remarkable new resolve amongst our colleagues to actually step up our commitment and dedication to the work we are doing. So and in that sense, very, very rewarding to work with the teams that we work with. Thank you.
Thank you, Amitabh. Well, one last question to all the 4 panel members, and really quick, I would like to hear your top 3 priorities going ahead in these times. Neeraj, first, let's begin with you.
Thank you. Thanks, Michelle. So, for me, the first thing is that I want to convince my team, and I want to convince actually all of you that it's not so bad. You know, we've got, if you think about the impact has been very bad, but the actual COVID infection, it's a highly infectious disease, but the fatality rates are not that high. We need to calm down a little bit. We need to get out of this fear psychosis, and we have to get out there at some point, because, you know, we've killed the economy, we've killed our public health system, we've killed everything else because of this disease. That needs to stop. We're just overdoing it. I think one more thing that I would really like to say is that work from home is important, but I feel very uncomfortable doing it if my team is out there in the field. And if I'm sitting in the comfort of my home, I just, you know, for me, that leadership style doesn't work. I have to get out there. Even though actually I could do all my work from home, but I am in the office every day even now. Even though when I got out of the office, my son picked me up and he sprayed me with sanitizer before he let me in the car, but I still will do it. So we will try to be safe, but we will have to go back to work like the rest of India. I think the other thing that I would like to say is that we have to be very nimble, very, very quick. We have to be able to change very fast because we don't know where this is going. And it's just not over yet. So, you know, we don't know where it's going. It could finish tomorrow. It could continue for 2 years. Let's be nimble. Let's be ready for all kinds of change. I'll stop there.
Thanks, Neeraj. Jayanti, your views, your top 3 priorities moving ahead for the organization.
I remember what a saying that Winston Churchill used to say, that was that you should never let a good crisis go to waste. So this is, I think, the worst crisis we can ever think of. At least in our generation, we would not see anything which is as bad as, we are still trying to get out of this. So this crisis has also given us a lot of opportunities. It has allowed us to look at the blueprint of the way we work and maybe redo everything that we were doing earlier for the better, you know, and come out stronger in this crisis. Better planning, better strategizing, everything, because there are so many learnings that we are all going to get in this very short period of time as we are going through this. And then the opportunity to strengthen and consolidate our stakeholder relationships. There are stakeholders who are going to stand by you no matter what, and you know that you can depend upon them to go with you. There will be some who are going to fall by the side for sure, but also an opportunity to strengthen whatever is coming your way now. And third is to capitalize on the new opportunities, new funding opportunities, new partnership opportunities, as I said earlier, coming together of organizations to work together. I think for me, these are the 3 things I feel I would like to take as something good to go forward with.
Sure. Amitabh?
So thank you. So just a very quick on the lighter note, Neeraj, I'll agree with one of the things you said and disagree with one. Certainly that it is not the only crisis that we have. There are multiple issues that we need to face. Totally take it. But the second one where I disagree, it's not that we have killed the health system. It is the crisis has not killed it. It has just amplified that it was anyways a broken system. So that's what I would want to say. You know, in terms of moving ahead, the 3 priorities, that the health system as a broken system cannot work. We need a robust public health system, a right to health. The second, that livelihoods is something that we need to work on. And when I say livelihoods, it's the entire piece. And the third is the criticality of social protection. And at some level, really going back to what we've been earlier saying, that it is social protection from cradle to grave. And you cannot run a society like India, or for that matter, any society without adequate social protections. Let me just smuggle in one more, that I do think that we need to fundamentally relook at our paradigms. This is really the time to reboot ourselves. So from the economic system, which creates inequality, I think this is the moment we need to relook at that. So the role of the state, we must use this as an opportunity to start reimagining how society, politics, economics should look like. Thank you.
Sumitra? Sumitra, you're on mute. Can you unmute yourself?
agreeing to everything that my co-panelists have said, including the very big picture priority list that Amitabh has listed. I'll very quickly focus on us as development sector leaders in terms of the top 3 priorities. For me would be: 1, communicate clearly, regularly, timely, and with empathy with our communities, teams, donors, board members, other partners. No one is an expert. Be open to listening and sharing and learning from each other. Second, as a leader, I think demonstrate from the very top as a doer. This is not the time to be a manager. This is the time for action. We must take full responsibility, set the path, support the team, and the team will set on itself on the path and do wonders in terms of the actual work on the ground. The third thing, building on to Amitabh, is the advocacy piece. This crisis can also be an opportunity to amplify the interconnected rights of children with all the health, nutrition, migration, livelihoods issues that we are playing through. So keep talking about the issue, just like in this platform. Bring the focus on young children and children's rights and their future in all kinds of platforms to help make policy change. And the last one I'll also sneak in here is that leaders have a lot of responsibility in every sector, including in the social sector. We don't have to turn martyrs. We have to spend some time on ourselves, being safe, healthy, both physically and emotionally, because our teams, our families, and our communities do need us.
Thank you so much. Thank you for those 3 top priorities that each panelist have put ahead. And I'll quickly take 2 audience questions. We have received a lot of audience questions. We may not be able to answer all of them. And I do see that we have overshot the mark of one hour that we had set aside. So really quickly, we have one interesting question which is open to all panel members. Any one of you all could just speak about this. This is about, is crowdfunding the future of philanthropy? Who would like to take this question?
Jayanti, it's over to you.
Amitabh?
Yes,
Or Amitabh, yeah.
I'm very happy to take that. As in, I would just, rephrase the question. Philanthropy is going to have its own space, and we must invest in philanthropy, getting far more engaged philanthropists, start looking at social justice philanthropy and so on. But yes, I think it is individuals giving way smaller amounts. That certainly is the future. And that is the kind of money that organizations need to have both independence and their ability to do long-term planning with their own vision and missions in place, and not the vision and mission program lock frames of the donors. Thank you.
Okay. Neeraj, this question is for you. How do you see primary healthcare evolving in the post-COVID era?
So I think that's a very important question, because actually, if we had a well-functioning primary healthcare system, we probably would have handled this crisis very differently. So I think in the post-COVID era, our entire focus of our health system needs to move to primary care, and especially for primary care for people living in low resource settings, people who can't afford, people who are going to the public health system, or even the lower end private healthcare providers. And I can already, the government is already starting to understand and talk about it. So that's the future. If we don't fix our primary healthcare system, the next crisis is going to be just as bad, or it could be worse.
Thanks, Neeraj. One last question before we close the session. And this one is open to any of the panel members. Will COVID and work from home have a positive or negative impact towards diversity in workplace? Who would like to take this one? Jayanti? Yes, Jayanti, please go ahead.
I'm not too sure that there's a clear answer to that, because we all strive to see to it that there is already diversity at the workplace. So I'm not too sure how I can answer something that whether working from home is going to lead to diversity at the workplace. We could probably keep that as a requirement, because you are, since you don't need to actually go to work. I mean, like I'm assuming being more inclusive, for example, people are not able to travel to the office, or be outside, could actually work from home itself. So in that case, yes, I mean, you could get a lot more inclusiveness in your organization because of that. So yeah, I think actually that's a very good question, because you can actually get a lot more people who would add value, but for so many reasons probably could not work in a structured office environment, but have things to contribute to from their homes. Yeah.
Yeah, I think, Jayanti, just to add to that, I mean, you're right. From a gender perspective,
Yeah.
I think it should bring in a lot more people into the workforce,
I think
people
so.
who actually had other priorities. And also, like they do overseas, working, 4 hours a day kind of structure.
Yeah.
That could also really expand our workforce. I think the question was actually pretty well thought of. My initial response was, I don't think it'll have any impact. But the more I think about it, I think this could be a collateral advantage that we're going to see from COVID.
I think so. I mean, I must compliment the person who asked this question, because it really is something which, as Neeraj said, my first reaction was, okay, now what do I say for that? But no, it's actually very, very pertinent. For example, women who have families to look after, who don't have support for childcare maybe, but as Neeraj said, can devote 4 or 5 hours and help you out. Help, but they can work from home. All they require is some technology help and access to connectivity. And that would make it possible. Yes, surely. This is something I'm going to take back to my team, actually, that we need to keep this in mind. So thank you for that.
Great. Thank you, Jayanti. Thank you, Neeraj. Amitabh, is there something that you wanted to add to that particular question?
Yes.
Yes.
And I thought Sumitra also wanted to do something,
yes.
Because she's done actually a full edition of a particular magazine looking at this question. I would just say, so this is very interesting. It does open up several opportunities, particularly from a gender lens. However, there are multiple forms of diversity that we'll need to look at. Ultimately, if you start looking at, say, the caste diversity, the question of ethnic diversity, and then their ability to work from home in terms of the residential complexes where they're living, the noise that we have. Not many people are fortunate to have independent rooms, and so on. So it is a very important question. We need to start looking at it. Like Neeraj highlighted, there are dimensions which could actually help us in building greater diversity, but there will be also several problems. As in my experience, and I'm fairly convinced, technology often ends up reducing diversity. We keep saying exactly the opposite, but the impact is that you leave the most left behind anyways. So it does need a lot of very serious thinking.
Thanks, Amita, for bringing that. Yeah, I think a very interesting question, and is just like all of you, my first thought was, well, diversity needs a piece of work by itself, whether you work from home or you work from office. So I think that's important, that whether we're working from home or in the traditional environment, diversity must be a policy priority within the organization. And only then we can ensure diversity and inclusion at our workplaces, wherever we work. And also what you mentioned about enabling the environment, this is a good opportunity to look at women's participation, to look at persons with disabilities who've had mobility issues, who were not able to come to offices, to also recognize that there are people who can contribute to towards the work, and very significant contribution can come from such people as well. But also very quickly the mobile crash experience, when we took on to this amazing technology boom in early April, there were real issues for the first 2 weeks to 2 to 3 weeks, where a lot of our frontline workers messed with technology. So it also needs that enabling factor that both caste, class, and all other kinds of issues that get silently invisibilized must be taken into account when we are thinking of using technology as a means for promoting diversity within the organization.
Michelle, all four of us would like to hire this person who asked this question. So, I think you've got a job there.
Great. I'll get back to you with the name later, Neeraj.
Really, that was a wonderful question.
And well, we've heard from some outstanding panelists and leaders of organizations on how they've been able to manage and navigate through these times. And of course, looking for what the new normal looks like. I thank the audience for their patience and for listening in, and also for your participation. And with that, we come to a close for today's session. I would like to extend a big thank you to all the panelists for shedding light on some of the pressing issues that we are facing today. Thank you so much. Thank you for joining in, and we look forward to seeing you in our next session with yet another exciting topic.
Thank you, Michelle, and Third Sector Partner team.
Thank you all.
And all the participants.
Thank you, everybody.
Thank
Bye-bye.
you. Goodbye, everybody.
Bye-bye. Bye-bye.